Good afternoon, everybody. Welcome to our Monday update on COVID-19 for the Chippewa Valley for Eau Claire County. Again, we'll share with you local updates as well as our local and state data. Today is Monday, May 18th. Again, thanks for joining us. We do want people in this community to have the right information and the updated information and to know where to go to get additional information. This week is EMS week. We're recognizing emergency medical services personnel. We do have an amazing team in Eau Claire County, and we are very fortunate to have them. They're on the front lines, not only during COVID-19 times, but all the time, making sure that services are available for every emergency. We all need that in the time of emergency, and we are thankful that we have such a strong team in Eau Claire County. I also want to say thank you to all those people that over the weekend, particularly on Saturday when it was so beautiful, that were really focused on preventing the rapid and uncontrolled spread of this disease in our community. It makes a difference what each and every one of us do. I saw many in our community as I was out on Saturday particularly doing the right thing, and I really appreciate that. Paying attention to physical distance, making sure that they were keeping their circle small. I also saw examples where that wasn't the case, and I really want people to think about the consequence of rapid disease spread. This disease has not changed. The risk is real, and it's going to take all of us in this community to make sure that we are keeping the spread as controlled and low as possible. So an update, our state numbers are at now currently 144,502 negative tests for COVID-19. That's an increase of 4,828 since yesterday. Positive cases of COVID-19 by testing are at 12,687, an increase of 144 positive cases since Sunday. Hospitalizations now are at 2,068, and our deaths for COVID-19 in the state are at 459. The positivity rate for our cases in the state, again, those positives as a percent of our total tests, is right around 3%, which is a declining percent for the state as a whole. In Eau Claire, we are at 3,802 tests being done for COVID-19, an increase of 213 since Friday. Negative tests are 3,612, and we now have 76 positive cases for COVID-19 in Eau Claire County, of Eau Claire County residents. That's an increase of 9 cases since Friday. Again, we have a broad range of ages and a broad distribution of where those diseases occur in Eau Claire County residents. A couple of state updates for you from today. Governor Evers held a news briefing right before I came upstairs, and while we do not have a statewide order in place, there are a number of recommendations that are still coming from the state and work that the state is doing to assure that we control COVID-19 in our state. The state continues to recommend that we limit travel as much as possible, that we wear a cloth face covering when out in public, and that we minimize our interactions with others outside of our household. So again, continued reinforcement that the common sense public health approaches to stop the spread of this disease stay in place. They are really encouraging, like we are in Eau Claire, to practice physical distance and keep our social circle small. Governor Evers also announced the We're All in It Together initiative, which is a $75 million assistance grants for Wisconsin small businesses to get back on their feet following COVID-19 closure. That $75 million will be given as part of the federal funds for the CARES Act, the Coronavirus Aid, Relief, and Economic Stimulus Act, coming from the federal government. $2,500 grants will be available for small businesses starting in early June. Those costs would go for business interruptions because of the COVID-19 pandemic, and really are to support small businesses as they begin to reopen. Again, Small businesses, like all businesses, need healthy customers and need healthy employees, and these costs are to support those best practices. Again, the hope is that these grants will help our small businesses be open in a successful way. And we encourage not only for these grants to exist, but for all of us to use the small businesses that are in Eau Claire County. They count on us. And my strong encouragement is to you to go to those businesses that are demonstrating that they are following our local order and that they are utilizing the WEDC guidelines in order to have that best practice in place. Department of Children and Families at a state level also approved $51 million to support early childhood education and education providers. Those support dollars are to help those that are making sure that our workers can be working and to defray costs of following up on COVID-19 changes that they needed to do. We continue locally to have an incident command group that is focusing on child care, and it's a critical component of our response to this disease. Also released today at the state level were safety procedures related to the Wisconsin court system. That document just came out. They have now a phased process for resuming in-person judicial hearings and court cases. We are working closely with the judges in Eau Claire County and have met with them multiple times in the last number of weeks, but most recently at the end of last week about safe practices for Eau Claire County court system. And the judges and the court system are working through those practices for Eau Claire and the best practice guidance that just came out from the state. We also today are announcing that we have updated our local order. So last week we started with an order very quickly following the announcement by the Supreme Court that there was no order in the state. We had to respond very quickly overnight to have a local order in place. We have now had some time to review state and national research as well as best practice and data to continue to update that order, and we did that today. One of the areas that we were particularly concerned about actually two areas when we put the order together originally, what I talked about last week on both Thursday and Friday, is our order is based on risk. And the two places of risk with this disease that are most important are mass gatherings and the 6 feet distance. So the order surrounds those two areas of risk for coronavirus, for COVID-19, and really put into place some mandates around physical distance and around mass gatherings. We recognize that in order to reduce risk, we need to come up with strategies and recommendations and requirements around those places where it's not possible to maintain the 6 feet distance. And that's what the changes to the order that were announced this afternoon include. We worked over the weekend, the end of last week and over the weekend, to find all the best practices and pull those together, and worked with legal counsel today to add that in. Our goal with this order continues to be on reducing risk. With this disease, we can't eliminate risk, and we recognize that. This order is not business-specific focused, but risk-focused. Today, the new order, very similar language, provides some clarity for those very specific circumstances where it's not possible to meet the 6 foot distance requirement in the previous order. Safe, slow, and deliberate reopening are critical. This addition makes sure that we have reopening happening in those very specific one-on-one personal services in a way that reduces risk. We have to remind everybody that risk remains, and I'll talk about that in a minute. The order update will soon be available on our website. We wanted to be deliberate and slow in making these changes and make sure that they are based on best practice. A quick summary of the changes. If you are a business that cannot be done in any other way except as a one-on-one service that needs to be closer than 6 feet, there's an additional list of requirements that must be met in order to be open. That business needs to make sure that they meet all of the requirements under number 2. Those requirements remain. And in addition, there's an additional set of requirements, again, just for those businesses that have one-on-one personal service inside of 6 feet. Those additional requirements include things like the number of people that can be allowed as part of the service in any given day by that provider. It includes requirements around taking contact information and making sure that that is available in order to do investigation. There are requirements around use of face coverings by both clients and by the service provider. There's requirements around waiting rooms and other components. These are all in place so that those businesses that need to be closer than 6 feet can do it in a way that reduces risk as much as possible. We also cleaned up some of the language of the order to separate out recommendations versus requirements for all businesses. We determined after spending a couple of days with the order that it would be cleaner for people to read if those two things were distinct. So that's an additional change. No language change, but just order of the document is changed. We want to be clear that the order does not protect anybody. It does reduce risk. It doesn't eliminate risk entirely. We want people to understand if they choose to get a one-on-one personal service that requires you to be closer than 6 feet, that there's risk to both that provider, that service provider, and to the individual that is undertaking that service. If someone that is providing that service becomes COVID-19 positive, anybody that was visiting them as a client in the space of time that they were infectious will be required to stay home for at least 14 days to monitor symptoms. Similarly, anybody that goes into a service like this and becomes COVID-19 positive, it would be required that any service provider that was in contact with them stay home for at least 14 days. There's a real issue if we spread disease because these are high-risk contacts. They would be considered contacts and they would be mandated to quarantine and isolate in this situation. We also know that people see these services as important, and we recognize that as well. This is an opportunity to follow all of the best practices that are in this guideline and to develop a strategy to provide these services with the lowest risk possible. We also continue to strongly encourage those that are highest risk for COVID-19 negative consequences, so those negative outcomes that we know exist for certain populations, to think, to really consider not utilizing these one-on-one services for the time being. Those at highest risk, again, include older adults, those with specific chronic conditions, and those that are immune compromised. Again, the risk is real, especially for those that where there are no symptoms. And we are strongly encouraging those people to consider twice whether or not those one-on-one services are being utilized. We also encourage those that live with or are in close contact with people in that situation to also consider the importance of potentially not utilizing those services. Again, the risk is real of this disease, and even with the order language the way it's written, there's not an ability to say that there is no chance of spread. So again, we continue with this disease progression. We know that it is important that we all pay attention. We're counting on people in Eau Claire doing the right thing. I've received countless communications from businesses and individuals across Eau Claire that talk about how they see it critically important that the right strategies be in place to decrease risk. And we appreciate that and are counting on that so we do not have a spike in disease. The Chippewa Valley Economic Recovery Task Force is continuing their work to get sectors together, to work together on not only educating those businesses in those sectors about best practices, but really doing some encouragement so that we continue to have the right practices across our community happening regularly and reliably. We count on you to ask questions if you walk into a business and see things that do not appear to be following the order and or following the guidance of the Wisconsin Economic Development Corporation, to say something. That's how we will make sure that we're holding each other accountable and we're making sure that we continue to have as safe a community as possible. Again, please stay tuned to our website. Updates will be there regularly as the situation changes. That's COVID19eauclair.org. Please also call the call center if you can't get your question answered at the website. Again, the call center number is 715-831-7425. We will continue with our Monday, Wednesday, Friday schedule for media briefings this week, and I'm happy to answer any questions today. Yes?
Can you talk a little bit about what businesses are required to, comply with these new requirements that you have today? I'm thinking immediately hair salons, nail salons. Can you give us some examples of some other businesses that this could apply?
So the question is, what businesses are needing to comply with the order language that is out today? All businesses, all public spaces, as the order reads, all public spaces, public buildings are required to follow the order. So again, our order was written not as a business-specific order. This was written as an order to make sure that wherever we go in the community, we have some basic things met. So public spaces, both indoors and outdoors, and all public buildings. We know that some services, it's not possible to do by meeting the requirement of 6-foot distance. So again, the order applies to all businesses. Some businesses don't have to be within 6 feet. Those businesses are required to follow the original order language. There are a small percentage of businesses that can't supply their business without coming closer than 6 feet, and I think we all understand what those are. They're personal service businesses that don't have another choice. For all of those businesses, the new requirements are in addition to the existing requirements from the previous order. The new order includes all of the requirements together, so you can look at one place in the new order and not look back at the old one, but the new requirements include all of the previous requirements plus some additional requirements for those where 6 feet cannot be maintained in any other way. Yes?
Out of the 76 who've been identified as positive in Eau Claire County, how many of those are active?
So the question was, of the 76 cases that we currently have, how many of those are active cases? We update once a week about those that have completed their isolation time as a case. We last did that on Wednesday of last week, and every Wednesday we will continue to do that. I believe as of the 13th, which would be last week, Wednesday, 40 of the 76 were released from isolation. We'll update that again on Wednesday when we get together. Yes?
With the order that was in place last weekend, did you have to enforce it at all? Anybody or any business? And if you did, how did you do so?
Yeah, the order that was in place starting on Thursday, the question is, did we have to do any enforcement activities? And if so, how did we do that? We did check in with law enforcement this morning, and there were no enforcement actions taken. There was education done by many, both health department staff as well as law enforcement. There was some education that happened. Any complaint was followed up on, and those complaints resulted in education. Yes?
I think you may have answered this to some degree earlier, but Scott in our Facebook Live is asking, why aren't, and I'll leave the names of the stores up, but why aren't other big box stores under the same requirements as you're making smaller businesses meet?
So the question is, why are not big box stores under the same requirements that small businesses are required to meet? Under our order, all businesses, large and small, are required to meet the same requirements. Again, different than previous orders at the state level, these are not business-specific orders, and we really work to make them risk-based orders. So all businesses have the same orders regardless of size. Yeah.
Did you hear from a number of personal care attendants in the hair and nail field in making this change today?
So the question was, have we heard from personal care fields, those personal one-on-one services, as we made this change? The change was made based on science and best practice. We reviewed guidelines from multiple researchers and best practice places, and all of the recommendations that we have in the current order related to one-on-one services are based on that best practice.
I've heard that playgrounds in the city of Eau Claire are staying closed even though the county order says playgrounds need to reopen. Is that something that the county health department recommended that the city do? Can you talk a little bit about that?
Sure. So the question is related to playgrounds and whether or not they are ordered closed or ordered open in any of our orders. Again, our orders are risk-based, and it is dependent on the entity that oversees whatever that entity is to make sure that they follow the orders. Specifically, the question related to playgrounds is really a city or a county decision or a school decision if it's a school playground, and they would have to follow the orders to be assuring that all of the requirements can be met. Certainly, talking to the entity that oversees that that playground is the best bet to see how they are following those and what will be open when. Yeah.
In terms of not disclosing the ages of those who are active, is that, I understand you're not giving us the names and things, but by not even giving the ages, can you explain that? And is that a practice followed by other counties too?
So the question is related to releasing information on the cases that we have, some more identifying information like
Their ages.
Yep, related to their ages or other information that we may have. At this point in time, and that may change as we get more case numbers, at this point in time we are not releasing ages. That information is available on the state website for the broad range of cases, and right now we do have from teenagers to those in their low 60s that are cases in Eau Claire County. Certainly, as our case numbers increase, we have more ability to divide by age, and we likely will be doing that just as the state and other locations have done. But we need to get to a critical mass so we don't have numbers that are too small in any certain age group. Yeah.
Again, kind of bouncing off the big box sort of question. I'm wondering if the health department has been consulting with the big box retailers. We've gotten a lot of questions about, when our large retailers going to reopen. So have you guys been consulting with them and the Oakwood Mall on reopening?
Sure. So the question is related to big box stores, Oakwood Mall, those kinds of facilities. We are certainly, and whether or not we've been consulting with them about reopening. Again, the order is the same for all businesses in Eau Claire County. We are working as questions come in and working proactively to get information out to all operators of retail and other stores to make sure they understand the order and they have the resources needed to open. Places like Oakwood Mall and other retail operations that are not yet open have definitely been in contact with us, and we are working with them on best practices and advice as they move forward. It is really their responsibility to make sure that they can meet all the requirements of the order, and we are supporting them in being successful with that. We are allowing for a lot of creative solutions in meeting the order. Again, this is an order that was written to reduce risk, and we want to make sure that people have opportunities to think through how best to reduce risk in their specific settings. We don't require any date specific for some place to be open. They need to meet the requirements. Yes?
In terms of restaurants and the 6-foot distance, I know you're talking about personal services. We're thinking about hair and nails, but I know I saw one particular Facebook video. They used humor, but they were getting across the point that somehow they were interpreting they needed to be 6 feet from the table they were delivering the food to. So could you comment on where things sit with restaurants?
Sure. So the question is related to restaurants and how operations happen at a restaurant that in An incidental contact might mean that you have to get closer than 6 feet. Again, the order very specifically talks about risk for any business, not a business-specific order. In a situation like a restaurant where there's incidental contact because of delivering a plate of food, for example, that is considered as part of the order to be incidental contact. It is not considered a high-risk contact when we are doing case investigation, which has a very specific definition. So again, those are allowable under the current order for a restaurant or another facility like that to have those kinds of contacts. And then again, in those places where there's going to be a longer contact, to have physical distance, which is entirely possible. So a simple example in a restaurant is standing a distance away to take a food order if it's going to take any length of time. Delivering the food to the table can happen very quickly. Yes.
What will the enforceability be of, what can we expect in terms of, I'm sure, I talked with some in the hair field, I mean, they're excited to get open again, and again, they've got a lot to follow and adhere to, but will you kind of rely on somebody expressing a concern if something's not being followed, or how will that be enforced?
Sure. So the question is related to enforceability, especially with the new order that came out today. For all of the order, we are counting on businesses doing it right. We know that it is something that they need to read and review the language. That'll take some time to absorb. Many of them have been looking at their practices already, those that are wanting to be safer for their customers to make sure that they have practices in place have already been doing that. So their job is to review the order, make sure that they can do those things that are in place, and follow that order. Enforcing is, definitely we don't have capacity to send a public health team out to review practices at every single facility that we have, both those that are personal service facilities and those that are not. We are counting on people doing the right thing. We are counting on them calling with questions where they can't figure out how to do it quite right. And we are counting on the public, making sure that you use your feet to go to places that are following those practices, that are making sure that they are following the order. And when you're concerned, to call the COVID hotline. That's the number to call when you have concerns, and we follow up on all complaints, as does law enforcement if calls come in through the non-emergency call center, comm center number. So follow-up will happen when there are complaints. Education will always be the starting point. We know that some people need that education first and may not understand the full rules. There will be communication about stopping the practice that is in violation of the order, and then there will be documentation if that does not happen. Any other questions? All right. Thank you very much for your time today. We know that there's a lot going on and that it feels like we have new information regularly. We do. We continue to be hopeful for a statewide response to this COVID-19 pandemic. We know that it's critically important that we are working together on this. We want to assure you that in Eau Claire, we're paying attention to a serious disease. We're trying to work to make sure that we have every strategy in place to decrease the spike of disease in this community. And we're counting on you to continue to work to stay safe, to keep your circle small, to keep physical distance, and to take care of each other so that we don't have devastating consequences. Thanks. We'll see you on Wednesday.